Hello, my name is Summer Ellingson. I am finishing up my second year of the Doctor of Nursing Practice degree with a specialization in family nursing practice. And this is my final presentation for my Foundations in Health Informatics course titled Utilizing Video Conferencing for Family Involvement, a Healthcare Informatics Improvement Initiative. So to start, my problem is something that I find is very common in most ICUs across the nation. I have personal experience as a bedside ICU registered nurse, but this problem really stems from my time as an ICU nurse during the COVID-19 pandemic, because that's when I saw this problem really affecting my workplace and the families. And that problem was the inability for families to be present during daily grand rounds. So generally speaking, ICU patients are very, very sick. So most family members are at the bedside, as much as they can be due to the touch and go nature of just a patient being in the ICU and a patient being that sick. So because most family members are at the bedside, they're able to be present for what we call grand rounds. And grand rounds are these things that happen daily, and are essentially when the whole care team, including the intensivist, which is like the ICU doctor, the bedside nurse, the dietitian, case management, pharmacist, and all the therapies like OT, PT, they all get together and they say what needs to happen in terms of their specialty to move this patient in the right direction. And then during this time, they also hear each other's perspectives and just get a general overview about the patient's current status and where the patient needs to go to get better. So now usually, because the family's bedside during this time when we're presenting grand rounds, the family gets to hear all the updates from all the specialties at once. So the family gets to hear how the patient is doing. And then this is also a great time to ask questions from the family because you have every specialty present. And then the family just gets to really act as a patient advocate during this time, letting the care team know what the patient would and would not want. So imagine, when family is not present during grand rounds, what happens? What usually happens, is the bedside nurse that day gets multiple calls from multiple different family members asking for updates, asking for the plan. And the trouble is the bedside RN might not even know the plan, depending on the nature of some of these things. And also the bedside RN might not be able to tell the family the plan, just given the nature of these things. Like within our scope of practice, we are not allowed to, talk about MRI results and things of more delicate nature, like a poor prognosis and stuff like that. So then the RN essentially has to play middleman, hunting down all the doctors, asking them to give the family a call, and then kind of playing the middleman while also trying to take care of your patients and keep them alive. So it's very stressful during the day. So no wonder during COVID, it's estimated 100,000 nurses left the bedside due to stress and burnout. I am personally one of them. I left the ICU for a easier position in a procedural area in the cardiac cath lab. So, this issue hits home for me. So my proposed solution is to allow family to be present during rounds via video conferencing so they don't miss rounds. This leads to less added stress for the healthcare workers and greater outcomes for the patients and families. This is an image of a stereotypical rounding where you have all the disciplines, and notice the movable computers, how easy it would be to video conference someone while they're rounding. We'll hit on this later, but I just wanted to point that out. So I thought this image was a great highlighter of what patient and family-centered care is, because it has been shown that family involvement and engagement leads to better patient, family, and clinical outcomes, like I was hitting on. So much so that guidelines from professional societies like the American College of Critical Care Medicine, they recommend family engagement in patient care as standard practice in the ICU. Um, and it has also been shown that interventions that are patient and family focused leads to a decreased stay in the ICU. So this is also why major organizations like the National Academy of Medicine and the Joint Commission recommend engaging patients and their families in shared decision-making, and they consider it a pillar of high quality and person-centered care. So even more than just engagement, even more than just family-centered care, having families present during rounds in the ICU is associated with improved physician-family relationships, increased physician comfort, and increased family satisfaction with care. And it can also lead to improved post-ICU syndrome. And ICU syndrome is like what happens a lot in the ICU is people can get delirium a lot. And so it's the prevalence of psychological symptoms like anxiety, depression, and almost like a post-traumatic stress response from being in the ICU. Um, and so having family present during rounds improves post-ICU syndrome, so they're less likely for this to happen after hospitalization. Excuse me. However, there are individual and health system barriers that can hinder this encouraged involvement, like COVID-19. So even though COVID-19 is no longer a big contributing factor, family presence on rounds is not adopted as like a standard of care in many ICUs across America, which is really sad. So individual barriers can include things like the distance the family has to travel to be in person with the patient. So say the family and the patient don't live in the same town, or financial struggles of taking work off to be with the patient, because it is a lot of time and a lot of work that has to be taken off if they're in the ICU for 2+ weeks. Um, and then just like financial struggles of also taking work off to be with that, and then time constraints. So sometimes there's a lack of consistency when guarding when rounds are occurring. So that's a tough one for families because it's not for sure that every morning at 9 a.m. that the team is going to be here for your family member. And then health system barriers include things like provider discouragement. So, shocker, not every doctor is a people person. Not every doctor likes having to talk to the family every day. But also provider discouragement in the sense that, like, rounds are a great time for academic discussion with residents. And so sometimes family involvement impacts the time that the attending can teach the residents. And then some worries about patient confidentiality and lack of consistency with staff inviting families to join. Um, so my proposed solution to this conundrum of, wanting families to be involved and wanting families to be present during rounds, but also making it easy and accessible for them to participate is to allow the family to join rounds via video conferencing. Currently, a large portion of health systems utilize an EHR. Excuse me. 96% of hospitals, to be exact. And I know firsthand that Epic has Zoom integration with healthcare systems utilizing it for telehealth visits. So this makes me think, most EHR systems probably have the ability to produce some sort of video conferencing capability. Um, and I also know, during rounds like that picture I showed with those doctors having the ergonomic rolling computer carts that I pointed out earlier, and they take them from room to room with them. So how easy would it be if they already had the patient's chart pulled up in front of them? What if when the team is rounding, they can click on a link within their EHR that opens up a video conference, like either via Zoom or another video conferencing platform that, with the family on the other side, so the family could join them wherever they are. The family could be logged on to something kind of like a My Chart, similar to how patients log on when they're preparing for a telehealth visit. And this gives the family the opportunity to listen to the team's updates and the ability to ask them questions about their family's care. That way they don't miss out on rounds and aren't left, trying to get the nurse throughout the day and having the doctor give them a call like we were talking about. Timing could be a tricky thing, but we could say, rounds will be every day from 8 to 10, and you'll just have to have like your portion of the log on pulled up on your computer and just wait your turn. And when the rounding team gets to you, they'll click on your family member. So standard terminology, like what we were talking about in class, like the universal nursing language, isn't necessarily needed for this specific EHR function in the sense that like the Zoom link itself isn't capturing data. But I did just include, some common terms that I'm using throughout my project. So privacy and security. This is a big one. Due to the nature of video conferencing, there is a risk that patient privacy could be breached if people overhear the conversation from either side of the video conference. However, this is already a common risk even now with telehealth, as anybody could be in the room as these conversations are happening. And it could also be a risk during daily rounds in general, even if there wasn't a video conference. Um, so the American Medical Association published this article that I thought was really interesting, and it looked at, patients' perception of the risk versus benefit with telehealth. And patients with chronic illnesses believed the advantages of telehealth outweigh these risks of like breach of confidentiality. So with this in mind, the benefit of allowing family to be present during rounds outweighs the risk of, possible people overhearing the conversation. However, We still need to allow the family to understand this risk. So prior to signing up for like the video conferencing platform and having a login, the family member should sign like a consent form stating that they know the risks of partaking in video conferencing and telehealth. And then when they do log in on the online platform, there could be like a telehealth etiquette information pop up, similar to the one pictured here on the screen, that like when the family logs into the meeting platform, it reminds them, we are about to discuss private information, be in a secure environment, and then, by agreeing to log in, you agree to consenting to continue with this conference, something along those lines. Oh, and to also safeguard these meetings, um, to like set up for the account, there should be like a standard way to do this. So first, only one account per family and only one computer webcam can connect to the meeting at a time, just for ease of like provider communication. The person who can create the account must be the elected healthcare agent delegated in the patient's advance directive. If the patient doesn't have an advance directive, then it just follows the degree, like the common degree of relatedness that we all know about in the hospital. So like typically first the spouse, then in order adult children, then parents, and so on and so forth. If there is animosity and conflict among the family, this order will still be followed just for safety and of healthcare information and provider ease. So then, the elected family spokesperson, when the patient gets admitted to the ICU, that family member will be asked, if they want to create an account. And if they say yes, either the unit secretary or case manager will explain the process, help them set up the account, consent will be obtained, and then proper identification will need to be provided, like a valid ID, to ensure that they are who they say they are. So again, impact of video conferencing. I highlighted a lot of these previously on the other slides, but family involvement leads to better patient, family, and clinical outcomes, decreased length of stay in the ICU, allowing family members to enjoy rounds via video conferencing can decrease family anxiety, increase family satisfaction with care and care providers, and just improve communication between the care team and the family, because, the family's not missing out on rounds. Oh, sorry, this is what I meant. This is the pop-up that could look like, when they join the video conferencing during rounds, where it could say like etiquette, and by agreeing, you're agreeing to consent for this. So implementing and monitoring this solution. Proper implementation and planning are crucial to successfully promoting this intervention, like we've learned all throughout this semester. But here's my step-by-step. So first, all ICU stakeholders and health information technology teams should be educated about the current issue. This intervention won't succeed if you don't have the support of like the intensivists and the rounding teams, because they're the ones that are going to have to partake in it. So if they don't want to do it, that's going to be a big blockade. So educating them about the importance of like why including family is key to help get them on board. And then before you even do anything, get their opinions. What would make this implementation the most successful and the most easy for them? Like things like timing of the rounds, limiting logins for families that are being disrespectful, and just like in general, the clinician's thoughts about bringing a webcam into these rounds. So once you get your feedback, the informatics team will work with the EHR software engineers to develop the product. And once the platform is developed, all ICU staff and stakeholders need to be educated about this product. The purpose of the change, how the platform works, and how to educate families about it, and then implement it. And then post-implementation, to monitor the progress of this new initiative, the EHR developers and the informatics team can track the logins on the platform to see usage, as well as they can develop, like a post-conference survey that a lot of people get when they go to an appointment, just to get families' feedback about using the platform. So I made a case process modeling diagram of the workflow between the interprofessional teams developing the EHR platform for video conferencing during rounds. So you can just pause and look at this if you'd like. It's also my paper. So end user adoption. So given the nature that the best option is to just actually have the family present bedside, video conferencing for rounds won't necessarily be encouraged unless the family state that they cannot be in person with the patient, and then, it'll be brought up. So once it's known that it's not accessible for the family to be there, then the easiest way to just encourage end user adoption is to make it easy for the families to utilize the platform. And then, when they are on the platform, just be kind to them when they log in. So this circles back to like having your care team be on board and be nice to them. But this is all done by having a smooth, easy login, an easy process and platform that works well with few issues. So essentially, you need a robust EHR system with a great software engineering team and a great healthcare informatics team to make this come to reality. As previously mentioned, to assess system effectiveness, we can we can monitor the platform. We can look on and track the amount of logins, and then we can develop a post-conference survey to get families' feedback about using it. So, in conclusion, family involvement in the ICU is paramount for providing good quality care. When we provide family-centered care, an important aspect is allowing families to join grand rounds. An easy way to make this accessible for families to join is through video conferencing during rounds, which families can log in and join. A solid EHR system and a great healthcare informatics team and having ICU stakeholder education is key to making this intervention happen. So this improvement initiative, is done through health informatics, which we learned about in this course. Health informatics helps gather the data, implement the platform, and evaluate the solution to help just improve patient outcomes. Because that's why we're all here, great care for people that need it. And then these are my project references. Thanks for a great year. I learned a lot of applicable knowledge that will translate into my future career as an MP. So yeah, thank you. Hope you enjoyed.